Unlike general anesthesia, local anesthesia does not put you to sleep. It simply blocks the pain signals in the area being treated. So you remain conscious, you can talk with the medical team, and you can change your position if necessary. Because a hair transplant can take several hours, the anesthesia can also be topped up during the procedure if needed. So does a hair transplant actually hurt? There isn't a simple yes or no answer. The part where you may feel some discomfort is the initial anesthetic injections. You may feel a quick pinch, some burning or stinging for a few seconds, and some pressure as the anesthetic enters the tissue. But once the area becomes numb, patients generally don't feel actual pain during the procedure. Instead, you may notice pressure, some pulling, movement across the scalp, or occasionally vibration from the instruments. And if you do feel pain during the procedure, you don't simply have to tolerate it. Additional anesthetic can be administered at that point. So what happens after the procedure? As the anesthesia gradually wears off over the following hours, feeling starts to return to the scalp. You may experience some tenderness, tightness, mild soreness, tingling, or sensitivity. These sensations are generally temporary and usually become easier to manage over the following days. Now there are different types of anesthesia that may be considered during hair transplantation. The standard option is local anesthesia. That provides pain control while allowing the patient to remain fully conscious, and it is associated with a relatively quick recovery. Some clinics may also offer conscious sedation, particularly for patients who are very anxious about the procedure. Sedation helps the patient relax while local anesthesia provides the actual pain control. The patient can still respond to instructions, although they may feel more relaxed or drowsy. General anesthesia is rarely used for hair transplantation. Hair transplantation is minimally invasive, so local anesthesia is generally sufficient. In unusual or medically complex cases, the medical team may consider other options after reviewing the patient's overall health. So how is the anesthesia actually administered? First, the scalp is cleaned and the donor and recipient areas are prepared. The treatment zones may also be marked before the procedure. The local anesthetic is usually administered first to the donor area and then to the recipient area. Rather than one large injection, several smaller injections are generally used across the scalp. You may feel a pinch, some brief burning, or pressure, but these sensations usually do not last long. The numbness develops gradually as the anesthetic spreads through the tissue. The numbness itself commonly lasts for several hours after the procedure. Although this can vary depending on the individual, the anesthetic used, the amount administered, metabolism, and circulation in the scalp. There can also be temporary side effects. These may include numbness, mild swelling, tenderness around the injection sites, scalp tightness, and occasionally a mild headache. Less commonly, patients may experience light dizziness, brief nausea, increased sensitivity as sensation returns, or mild bruising around the injection sites. If you experience severe or worsening pain, increasing swelling, fever, pus, or unusual drainage, persistent numbness, or signs of an allergic reaction such as difficulty breathing or a widespread rash, you should contact your doctor. And finally, there are a few things you should do before receiving anesthesia. Tell your doctor about all medications you take, including blood thinners, aspirin, anti-inflammatory medications, herbal supplements, vitamins, and any previous reactions to anesthetics. If your clinic advises you to avoid alcohol, follow those instructions. Many clinics recommend avoiding alcohol for 24 to 48 hours before surgery. Ask your clinic about caffeine because recommendations can vary. If you are having the procedure under local anesthesia, you are usually advised to eat something light beforehand according to your clinic's specific instructions. And wear comfortable clothing, preferably something that can be removed without rubbing against the scalp. After the procedure, as the numbness fades, some tingling, tightness, mild soreness, or sensitivity can be expected. Your surgeon may recommend pain medication for the first day or two. Staying hydrated, avoiding pressure on the scalp, and sleeping with your head elevated if your surgeon recommends it can also help during the first few days. With local anesthesia alone, many patients can return home the same day, although you should always follow your clinic's specific advice. If sedation has been used, you should not drive yourself and someone else should take you home. So to answer the question we started with, does a hair transplant hurt? For most patients, the main discomfort comes from the initial anesthetic injections. Once the scalp is numb, the procedure itself is generally not painful. You remain awake, the medical team can maintain pain control throughout the procedure, and the numbness gradually wears off afterward. If you're considering a hair transplant and have more questions about the procedure, anesthesia, pain, recovery, or your individual treatment plan, we're here to help. At Istanbul Vita Clinic, our medical team is here to guide you through every step of your hair transplant journey and help you make an informed decision based on your individual needs. If you have any questions, feel free to get in touch with our team. Thank you for watching, and I'll see you in the next video.